vitiligo is a rather classic autoimmune condition where the immune system is responsible for destroying the cells in the skin that make pigment. And those cells are called melanocytes. So when you lose the melanocytes in the skin, you get a white patch. And that white patch is very visible in contrast to normal skin. It affects all races and ethnicities equally. It can occur on any area of the body, the face, the trunk, and the extremities. And it's a chronic condition that causes significant psychological, emotional distress for patients, given the visibility of the disease. There are several myths regarding vitiligo. One, it's cosmetic. Two, it's contagious. And a major message for anyone listening is vitiligo is not a contagious disorder.
Okay, well, my journey started about 3 years ago, where I started to notice some white depigmented patches under my lip, on the sides of my nose, and eventually spreading to my forehead, which completely depigmented. Now, I'm of Eastern European descent, so I'm fairly light skinned and I don't go out in the sun. So it took a while and I had to lose a lot of pigment to really understand that the white was not normal and the other pigment was my normal pigment. And it was very depressing to me because I am in the public eye. I'm in the entertainment business. Sometimes I'm even photographed and I'm on the red carpet, and I would look at the pictures and I felt, I don't look my best. I'm not at my best. And therefore I did not feel my best. And it was depressing. I went to several different dermatologists until I found Dr. Grimes, whose expertise is in this field. And she was able to console me. She took my hand. I burst into tears because I thought there was no real help for me. And she came up with a plan to manage this disease and to help me look to the future and have the patience to repigment, which I have, luckily.
The key tenets of treatment involve stabilizing the disease because it can be very unpredictable. There can be periods where the condition is stable. Then there can be periods of rapid progression. So as clinicians, we have to stabilize it and we have to be able to maintain the pigment. So we've made major advances recently in how we do that. We have many new topical therapies for vitiligo, as well as phototherapy or light sources that we use to induce repigmentation.
Well, there is a website. It is thisisvitiligo.com. There's another website that Dr. Grimes will give you. Learn as much as you can. Find the practitioner who has an expertise in this disease. Don't listen to your friends. It's not in your head. It's not a case of vanity. You're a guy. It doesn't really matter that much. I can't really see it. You see it and you look in the mirror and you see it and you know it's there. In fact, I'll share with your viewers, I am a survivor of cancer. And somehow, and you might think this is silly, but the cancer was not something I could see when I looked in the mirror, but I saw the vitiligo every day and was looking to see, is this better? Is this worse? And that was actually more depressing to me than the cancer, because my cancer treatment was very straightforward. And this took a little more patience. So that would be my advice. Learn as much as you can.
Go to key websites for information. This is vitiligo.com. Also, another key website, the Global Vitiligo Foundation.org. We have a list of physicians on that website with who have an expertise in diagnosing and treating this condition. Also, look for support groups in your area, because certainly as caregivers, we know our role, but I think it's so important for vitiligo patients to be able to share their journey with other patients who have the same condition. So that's available in support groups, and there's support groups listed on the Global Vitiligo Foundation website. And again, this is an autoimmune disease, but it's a treatable autoimmune condition. There is tremendous hope for patients in dealing with vitiligo, because we really have made substantial new and exciting advances.